My name's Dave Rex and welcome to my guide to micronutrient supplements. So we're going to consider four key questions in this presentation. Firstly, is your child's diet okay in the first place, in which case they might not need supplements? Would they benefit from supplements? And if so, which ones and why? And then towards the end, we're going to talk a little bit more about whether there is good scientific evidence to support their use. So according to the Eat Well guide, a well-balanced diet would include starchy carbohydrates, fruits and vegetables, calcium-rich dairy foods, and non-dairy protein foods like meat, fish, eggs, nuts, and pulses. I like to think of these as the everyday foods. Typically, when I take a diet history, these two food groups are reasonably well accepted. These two can be more of a challenge due to the level of variation, the flavour or smell, and particularly due to the complexity of texture. Food groups, of course, won't tell you everything. It's important to think about whether a child's eating regular meals, whether they're well hydrated, what their intake of added sugar might be like. So you could use something like this to get a broader assessment of how adequate and appropriate you think the diet might be. So there is a longer presentation on YouTube called Understanding, Assessing and Influencing Children's Food Choices. There's a link to it at the bottom there. This presentation is specifically on micronutrient supplements. What do we mean by micronutrients? Well, these are essential to health, but we say micro because they're only needed in very small amounts. They include vitamins, minerals, and essential fatty acids. The more limited the diet, the more likely these are to be needed, and the specific supplements depend very much on the child and on their diet. They're important for physical health, but also important for brain function. I'll be focusing specifically on what we might call some of the more brain selective nutrients in this presentation. Now we'll take a look at some specific micronutrients that are important for the brain. Firstly, magnesium that we find largely in green vegetables, vitamin D that we get mostly from the sun, iron that we get in red meat and pulses and green vegetables to some extent, and omega-3 that we get from oily fish. Each of these have important and specific roles in optimal brain function and more general health. So when it comes to supplements, for most children, there's a strong case for supplementing with omega-3 fatty acids and vitamin D. And for selective eaters, using a multivitamin and mineral supplement and possibly considering the additional use of magnesium. Okay, so looking at some of the detail, I've presented this here in a table where we look at the supplement, some extra guidance, information about dosage, the possible impact, and who it's for. And firstly, we're looking at general multi-purpose vitamin and mineral supplements. Okay, so we would consider using these if the fruit and vegetable group or the non-dairy protein group is limited in variety or quantity in a child's diet. That makes it more likely they're going to be lacking essential vitamins and minerals. And here's some examples. So we've got a product from Boots that's chewable and a couple of liquid products suitable for children of different ages. So now let's look at calcium. Calcium is needed for strong bones and teeth. It's often missing from the multivitamin and mineral supplements because it's very bulky, and because it's important for bone health, calcium supplements sometimes include some other bone health nutrients. Here's information about the dosage. These are overall requirements. The diet may already provide some calcium, and it's important for bone health, as is vitamin D. In terms of who it's for, then obviously children who are struggling to consume enough calcium-rich dairy food for any reasons are most likely to benefit from a calcium supplement. So that's really milk, cheese or yogurt. And in terms of an example of some products, we've got a liquid calcium supplement that includes a wider range of nutrients, and we've also got a calcium supplement that includes a small amount of vitamin D. So now we're going to look at magnesium, another bulky mineral that's often left out of vitamin and mineral supplements. It's sometimes found alongside calcium in bone health supplements because it does play a role in bone health. Here's information about magnesium requirements at different ages, and it seems to play important roles in brain function and may contribute to reducing anxiety. It also helps vitamin D do its job properly. Really, any child who doesn't eat green vegetables regularly is at risk of magnesium deficiency. So here are a couple of examples. There's a liquid magnesium supplement, and there is a chewable magnesium supplement there as well. Okay, so now we're looking at the essential fatty acid omega-3. This comes largely from oily fish. Products will list on the back the amount of EPA and DHA that they contain. We think that ones with higher levels of EPA may be the most effective. If you add together the EPA and the DHA figure, you get the recommended daily total for different ages. We think that omega-3 fatty acids play very important roles in brain cell membranes. So really anything the brain is required to do could be done more efficiently if the right level of omega-3 fatty acids has been incorporated into those brain cell membranes. And that means that mood, attention, sleep, all could potentially be improved by ensuring enough omega-3 either from oily fish or from a supplement. Okay, so the main dietary source, as we've highlighted, is oily fish, sardines, mackerel, herring, salmon, etc. And in terms of supplemental sources, we've got examples here of a liquid product, some capsules, and some chewable capsules as well. Last but not least, a quick look at the sunshine vitamin, vitamin D. Tablets range from 10 to 50 micrograms. Small amounts are included in multivitamin supplements, and that smaller amount is required for bone health, but we think that larger amounts might bring a wider range of benefits to immune function and mood. And there's some evidence of specific benefit for children on the autistic spectrum. Some more information about high-risk groups there, particularly children who don't spend much time outdoors. And these higher figures are still well below the safe upper tolerable limit set by the National Institute for Health in America and the European Food Safety Authority. Okay, so vitamin D found largely from the sun during the summer months, assuming that we're not getting enough of that, as very few of us in Scotland will be, then a couple of examples of supplements of different strengths there, both small tablets but containing very different amounts of vitamin D. So just a quick word about swallowing supplements. Younger children do tend to prefer or manage liquid supplements more readily, or tablets can sometimes be crushed, or they can be chewed or sucked. For children over 8 years of age, many do have the capability of swallowing tablets or capsules whole, so they're experiencing less of a taste. Some older children, though, do still struggle to swallow tablets or capsules, which can be a problem not just for nutritional supplements but for medicines as well. And if your child finds it hard, you can follow this video on YouTube to learn how to develop confidence and the right way of swallowing for you over the course of a couple of weeks practice. So if you're just interested in the practical stuff, you can stop there after the first 10 minutes. That should give you enough information on supplements. If you want to be clearer about the thinking behind those recommendations, then do watch the following slides to understand more about the scientific evidence that I've based my advice on supplements on. Okay, so how good is the scientific evidence behind the use of nutritional supplements and nutrition interventions more widely? So we need to think about what we mean by scientific evidence, and typically with drug treatments that involves looking at clinical trials, deciding whether they work and whether they're safe. And those trials must allow for bias and also for coincidence. They do this by comparing two similar groups, a treated group and an untreated or placebo group within the study. Participants are blinded to which group they're in, and sometimes the researchers are as well. When the researchers only know who's in which group afterwards, and the participants do as well, that's what we call a double-blind controlled trial. And if the two groups are relatively kind of randomly assigned into the two groups, so the two groups look reasonably similar before the study, then that's what we call a double-blind randomized controlled trial. And that's the kind of gold standard of evidence for medical interventions. The drug is then effectively invented, tested, patented, and that drug can then be produced at a profit. Some of the profit is then used to invent and to test new drugs. So when it comes to scientific evidence in nutrition, we need to follow the do no harm principle. Real food isn't patentable. It already exists in nature. And it's quite hard to design a blinded study with real food. So for example, if you have a study where half the participants are eating cabbage and the other half are in the placebo group not eating cabbage, you know which group you're in. And that leads to the bizarre conclusion when we follow this narrow idea of good quality evidence from randomized blinded control trials that pills are always more effective than nutrients, nutrients are more effective than foods, and foods are more effective than whole diets. And yet we know from nutrition more broadly that patterns of eating and whole diets we have more confidence in than we do evidence around specific foods or nutrients. And clearly what we eat is more essential to health than drugs. So we need a different set of rules to decide what good quality evidence in nutrition looks like. Okay, so let's take a look at the 5 golden rules then that I use when I'm considering nutrition related evidence. First of all, I would look for whether there are plausible mechanisms through which the nutrient, food or diet that's being proposed might help. I would look at whether there is some evidence from clinical trials, even if that evidence is a little bit patchy. I would look for some evidence from clinical trials that support the evidence. And I would also look at whether there's evidence that currently the intake of the nutrient being proposed is already marginal, in other words, insufficient typically in the population, or whether it's already at excessive levels. My 4th rule will be whether the food, nutrient or diet is broadly consistent with healthy eating messages. And finally, are there populations who consume the nutrient, food or diet at the level recommended without any obvious harmful effects. So you could take an intervention like omega-3 or vitamin D, for example, and apply these rules to see whether that seems like a sensible intervention. And similarly, another specific nutrient that might be recommended for a particular purpose, you could apply these rules and come out with a pretty sensible answer as to whether it's a sensible thing to do. And finally, and even more pragmatically, we can consider another 4 rules. Is it affordable? Is it practical? Is it palatable? And is it the top priority given the other dietary difficulties that a child might have? So if we look at a little bit of the evidence from clinical trials on the use of supplements, giving supplements to people who are already well nourished is far less likely to be beneficial, of course. So if we take a more vulnerable population, such as this group of young offenders in England, we can see big differences between the group who were given a vitamin, mineral and fatty acid supplement compared to those who were given a dummy placebo treatment. We can see a sharp reduction in the number of recorded violent offences committed by those receiving the supplement. And similar findings have been found from research in the Netherlands and in America since this study was carried out. So we can surmise that the participants might have been more likely than average to have had poor diets over a period of time, and making good the deficiencies that they had accumulated over that time had improved behavior significantly. So here's a study on neurotypical children using omega-3 to influence sleep, and you can see here that the children who got the omega-3 supplement compared to the placebo gained significantly more sleep on average. That's evidence from the last two slides that omega-3 influences sleep, and that a wide range of vitamin and mineral supplements influences a vulnerable subgroup in the population who might be more likely than average to have had poor diets for all sorts of reasons. This slide shows a kind of study of studies, a meta-analysis of some of the research that's been carried out using omega-3 from fish oils in reducing ADHD symptoms. And we can see that it is significantly beneficial for children with ADHD. It seems to make a bigger difference to poor attention than it does to hyperactivity. So a modest but measurable beneficial effect. Now, this study has some methodological flaws. I'm not clear from reading the paper that it was necessarily a blinded study. I think it may be that the participants knew whether they were in the supplemented group or not. But nonetheless, it shows significant improvements for children with ADHD from taking a magnesium supplement. Now, I would imagine that that's particularly likely in the children who were deficient in magnesium in the first place, which, as we know from dietary surveys, may well be quite a high proportion of children. So vitamin D, of course, is beneficial for bone health and a wider range of potential health benefits as well. But this study looked particularly at children on the autistic spectrum and found significant reductions in both hyperactivity and irritability in children with autism who were given a vitamin D supplement, and reductions in irritability from giving them an omega-3 supplement. So just to put this clinical trial evidence into a broader context, the clinical trials are promising but limited in number and sometimes in quality. Supplements do tend to work best in people who are already deficient, of course, so the more selective a child's diet is, the more chance the supplement will be beneficial. The difficulties that children on the autistic spectrum face in relation to their diet can be due to a combination of psychological or sensory differences, and do take some time, if you haven't done already, to see the video on YouTube that I mentioned earlier. Towards the end of that video, it does give some practical guidance on influencing selective eaters. For children with a neurodevelopmental diagnosis, there may also be some metabolic differences, meaning that their requirements are slightly different. So, for example, it may be that some children with autism or ADHD actually have a greater than average need for omega-3, but again, that's disputed in the scientific literature. Okay, so my last slide, by way of a summary, micronutrients are essential for healthy brain function and general well-being. The poorer the diet, the more likely it is that these need to be given in supplemental form. Some nutrients are more important for the brain than others. They're what we might call brain selective. And there is some evidence that ensuring an adequate intake can make a real difference to general well-being, but also specific aspects of brain function. And finally, of course, you need to match the supplement that you're giving to the particular dietary deficiency that a child might have. Thank you for listening.